sometimes with chronic health problems, urinary tract infections, arthritis, neuropathy, either in your hands or your feet, etc., is from the body developing a nerve memory. So what is a nerve memory? Well, a nerve memory is when we get this improper impulse where maybe it's an infection like postherpetic neuralgia, or we've had an industrial accident or a finger get pulled off, or sometimes we have your gallbladder removed. We call it phantom limb syndrome or phantom gallbladder syndrome. And what's happening is the nerve is injured and it's telling the nervous system, I hurt, I hurt, I hurt, I hurt, I hurt. And so we've got to break up that cycle. We've got to break up that system. And so with neuropathy, it's no different. If it goes north, it gets up in your eyes and it's wet and dry macular degeneration. And if it goes south, it can get into your feet. You can't feel anything. And sometimes it gets in your hands. Sometimes it's on an accidental side effect for chemotherapy. And we call it chemo neuropathy. But all of these different nerve conditions, anxiety, depression, sciatic, carpal tunnel neuropathy, eye problems, not only is it just neuropathy that can be helped, it is all conditions. And so this is a nerve diagram of looking at what they call saltatory conduction. These are sodium potassium channel gates. And that nerve impulse that goes down the body, literally it goes in these waves like this. And sometimes those gates, they get stuck open or they get stuck closed. And we have this improper impulse that occurs. And it's telling the brain, even though the infection's gone or the body part might even be attached, I hurt, I hurt, I hurt. Well, it can also happen without an infection and without trauma, like going to the nerve endings, and it's going to be painful. And so what we want to do at a high level view with any chronic pain patterns, any chronic illness, any chronic situation where the nerves are getting irritated is reduce the inflammation as much as possible. We do that in 3 ways. The first one is you want to try and reduce inflammatory foods as much as possible. That's number 1. Number 2, you want to insulate the nerve with alpha lipoic acid and omega-3, 6s, 7, 9s, and 12. So small, medium, and long chain fatty acids. We want to reset the nerves by using the hyperpolarization, depolarization, repolarization effect. And of course, stress makes everything worse. So this is really easy to say, and it's a challenge to do. It's not easy to do this. But if we look at the nerve cell, so just looking, you have the little feelers on the end, then we have the axon, then we have the insulation around the nerve called the myelin sheath, then we have basically the cell body, and we want to protect as much as possible that process. We want insulation around the nerve. That's the essential fatty acids. So there was a Dr. Huneke that discovered a really neat way to treat nerve conditions. His sister, she had severe migraines. He accidentally, or maybe he was just desperate, he injected some para-aminobenzoic acid, it's in a product called Procaine, into a scar on her finger, and all of a sudden her pain went away. So he would literally was the father of what we call neural therapy. And he actually was able to show that there's something called a flash or a Huneke phenomenon where literally he could turn off and turn on conditions. If there was a flare up of a red bone scar, and then he injected the scar, and all of a sudden the shoulder pain went away. And so he was the one that, and this is such an important part of our practice, is when we have chronic pain patterns, chronic illness problems, we got to reset the nerves. And this may be a cause of symptoms and distant from the site of pain. So if you treat people and their symptoms improve for 8 hours or 20 hours, what happens is you usually can work on the tonsils, the hip pain, and the underlying cause can literally most times be improved. So sometimes it takes a little bit longer to have a response. Sometimes it's 24 to 48 hours afterwards. Sometimes if you are in an interference field, which is blocking energy in the body, you get initial worsening. Sometimes you cause a drainage phenomenon. So when you go to reset the nervous system, nothing really surprises me. And I think that this is really important because there's so many people that come into the office that have some type of chronic health problem, chronic pain pattern, chronic illness, autoimmune. And because it doesn't fit into the perfect box, what happens is a lot of times our traditional doctor will say, well, you're psychosomatic, it's all in your head. You need a happy pill, you're depressed, you need to have a hobby, you need to have a change of job, you need to have a different relationship. And really what's happening is it's that nervous system that is getting stuck. And so this is why it's so important, not only for neuropathy, but for so many different conditions. So we want to basically surround the dragon that's over the area. So for neuropathy in your feet, we are specifically working on the nerves that go to the feet. We're also working on the vascular system that's going. If we're doing it for a chronic pain pattern on a shoulder or eyes or something like that, and we do these little tiny blebs around the area. They look like little mosquito bites. They're good for pain, for all of these different weird sensations. And then we get some feedback. So it helps with radicular pain, or does it help the trigger points? It helps disc problems. And literally, this is my favorite thing. It's so helpful for just about everything. Again, put up literally everything, but particularly for neuropathy.